Well, thank you, Mr. Chair and Ranking Member Murray, again for holding these hearings. Thank you to all the witnesses for being here today. We really appreciate your time and your expertise. Just as a kind of introductory matter, because I've been going back and forth to different hearings, I take it that there's general agreement among you that in terms of market stabilization right now, having the CSRs continue for more than a year is a really important thing. Do I see head nods generally? Okay, I'll take that as a yes. I wanted to touch on an issue that is particularly challenging in my state of New Hampshire. I know many of you are familiar with how states are grappling with the opioid addiction crisis. New Hampshire has been particularly hard hit. So I understand from a former governor's point of view how important flexibility is and how important the flexibility within the 1332 waiver process is. But I also believe it's critical that we make sure people have access to comprehensive coverage and really protect those guardrails in 1332s. And Mr. Tyson, this is a question for you. Essential health benefits like coverage for substance use disorders ensure that people get treatment. And in my home state right now, it is particularly important that those trying to build up treatment capacity know that there's going to be coverage for treatment. So do you agree that as we consider stabilization options, we need to make sure that people maintain coverage of these essential health benefits, including substance use disorder services?
Yes, I agree.
Thank you very much. Another question that has come up in some of the testimony as I reviewed it was testimony, I think, from Mr. Bragdon discussing widening the ACA's age bands. As you know, currently plans can't charge older adults more than 3 times what they charge younger adults. Widening the age band would let plans charge older adults more than this. And actually, way back before the ACA, when I was in the state Senate in New Hampshire, there was a bill passed that allowed the widening of age bands, and we saw increases of a couple 100% for middle-aged folks, especially people who own their own businesses. So I have concerns about the idea, and Mr. Tyson, I'm interested in Kaiser Permanente's perspective here. Does your organization support widening the age bands?
We prefer not to. We do think that the issue of how you balance the overall cost, how do you incent the younger, healthier population to get into the pool, and how do you make sure that you're not overtaxing the elderly population and or the high-risk population is part of that calculus. Yeah. And we would prefer not to widen it to the extreme.
Thank you very much. Lastly, we've talked, a number of us have asked questions about the importance of advertising and outreach here. But Ms. O'Toole, I just wanted to go back to that for a second. If we reduce funding for advertising and for navigators, if the federal government reduces that funding, what do you think that does in terms of market stability?
Thank you, Senator. I think it makes it worse.
Thank you very much. That's all the questions I have at this time. Thank you, Mr. Chair.